Your toddler isn't talking as much as other kids their age. You're counting every word, tracking each new sound, and there's a knot of anxiety tightening in your stomach. When you bring it up, well-meaning friends, family, or even your pediatrician might say, "Let's just wait and see," or "Don't worry, they'll catch up." But your gut, that powerful parental instinct, is telling you there might be more to the story. You are not alone in that feeling, and you are right to listen to it. While a delay in spoken language is the most common reason parents seek an evaluation, researchers emphasize that the underlying neurobiological signatures of a simple speech delay and autism are fundamentally distinct. They are less focused on the surface symptom of not talking and more on the qualitative nature of a child's social communication. In this video, we're moving beyond the vocabulary list to uncover 9 key signs that experts look for to understand a child's unique developmental path. This isn't about creating worry. It's about giving you clarity, empowering you with information, and helping you have a more informed, productive conversation with your doctor. Sign 1. The social compass behind communication. The first and most fundamental sign has little to do with how many words your child has. It's all about why they try to communicate in the first place. Specialists call this communicative intent, the social drive to connect. A child with an isolated language delay is often a master of mime, making up for their lack of words with a rich library of nonverbal communication. They are desperate to connect. They'll pull you by the hand to show you something, use dramatic gestures, make a variety of sounds, and use their eyes and facial expressions to get their message across. They are often frustrated by their inability to speak and will work overtime to bridge that gap. In contrast, a core feature of autism is a difference in this social motivation. Research shows that differences in gaze patterns can appear in autistic infants as early as 6 months, altering how they engage with caregivers. They might be content playing alone and may not show as much frustration when misunderstood, because that underlying drive to share a thought or experience is wired differently. This isn't a choice. It's a fundamental difference in the brain's social compass. The social world simply may not hold the same pull. So the question isn't just, is my child talking? The deeper question is my child trying to connect, with or without words? Sign 2. Pointing to share versus pointing to get. This leads to our second sign, one of the most reliable early clinical markers, joint attention. It's that simple act of sharing an experience by looking at something, then looking back at someone to share that moment. Here's the classic scenario. A child with a language delay sees an airplane. They'll point at it, then immediately look back at you, as if to say, "Wow, do you see that too?" This is called proto-declarative pointing. It's not about wanting the airplane, it's about sharing the joy of it with you. They also consistently respond when you point and say, "Look at the puppy." Now, let's contrast that. An autistic child may also point, but the function is often different. They are more likely to use proto-imperative pointing, pointing only to request something they want, like a cookie on the counter. The pointing is a tool to get a need met, not a bridge to share an experience. They are far less likely to point to that same airplane just for the social pleasure of sharing the sight with you. That social back and forth is a key differentiator. Sign 3. The social antenna, responding to their name. By about 9 months, most infants instinctively turn their head when they hear their name. A child with a simple language delay typically has a consistent response. Their name cuts through the noise because they're socially tuned in. For an autistic child, the response can be strikingly inconsistent, which often makes parents worry about a hearing problem. They might hear the crinkle of a snack bag from another room, but seem to ignore their name being called just a few feet away. This isn't usually a hearing issue. It's an issue of social salience, what the brain prioritizes as important. To a neurotypical brain, a human voice is one of the most important sounds. For an autistic brain, non-social sounds or sights might be equally or even more compelling. Their name just doesn't carry the same social weight that automatically grabs their attention. Sign 4. How they play. Flexible imagination versus rigid repetition. How a child plays is a window into their mind. The differences here can be stark. A child with a language delay, despite verbal challenges, usually engages in rich, imaginative pretend play. They'll pretend a banana is a phone or feed their stuffed animals. Their play is symbolic and flexible. For many autistic children, play is marked by what experts call restricted and repetitive behaviors, or RRBs. Instead of making a toy car vroom, they might get fascinated with spinning its wheels over and over. Instead of feeding a doll, they might arrange all the play food in a perfect, rigid line. This isn't pretend play. It's a form of organizing that can be very calming. They may get extremely distressed if their line of toys is disturbed. This behavioral rigidity is a hallmark characteristic of autism that's rarely present in a child with only a speech delay. Sign 5. The world beyond words. As mentioned, children with a language delay are often excellent nonverbal communicators. They compensate for their lack of words with an abundance of other signals. They wave hi and bye, nod, shrug, and use a full range of facial expressions. They are also masters of imitation. If you clap, they try to clap, which is a powerful engine for social learning. In autism, the communication challenges often go beyond spoken words to include a limited use of gestures. They might not spontaneously wave back or point to things just to show you. Their facial expressions may also appear limited or not seem to match the situation. This lack of nonverbal back and forth, the gestures, shared expressions, and imitation, is a critical piece of the puzzle that distinguishes a pervasive developmental difference from an isolated speech issue. Sign 6. Mechanics versus social use of language. Pragmatics. This sign distinguishes between what experts call developmental language disorder, DLD, and autism with language impairment, ASD-LI. While both groups may struggle with the mechanics of language like grammar, the core differentiator is pragmatics, the social use of language. A child with DLD struggles with rules, but uses the words they have for a social back and forth. An autistic child, even with a big vocabulary, often has major challenges with pragmatics. They might use echolalia, repeating phrases out of context. Their speech might have an unusual, robotic, or sing-song tone. They may struggle with pronouns, frequently mixing up I and you. In narrative tasks, research shows they might produce structurally coherent stories that lack semantic richness or fail to consider the listener's perspective. They may seem to talk at you rather than with you. Sign 7. A surprising link. The motor-speech connection. This is a more subtle clue, but it's an area of growing research. For children with a simple language delay, their motor skills are typically on track. In autism, however, emerging research identifies a powerful link between motor development and language. One study highlighted that fine motor skills at age 3 are among the strongest predictors of expressive language levels at age 19 in autistic individuals. Difficulties with motor planning, the ability to plan and carry out an action, can impact both the small muscle movements for gestures and the complex coordination required for speech. You might observe this as a child who seems clumsy, has a hard time using a fork, or has an unusual gait, like toe walking. While these things can happen for many reasons, a pattern of language delay plus motor skill differences can point toward a more global neurodevelopmental difference. Sign 8. The red flag of regression. Most children with developmental delays move forward, even if slowly. A significant loss of previously acquired speech or social skills is known as regression, and it is a major red flag for autism. A parent might describe it like this. He was saying mama and dada, and then one day he just stopped. The words vanished. This is reported in about 20 to 30% of autistic children. typically between 15 and 24 months, but is virtually never seen in isolated speech delays. It's critical to know that any loss of babbling, speech, or social skills like waving or eye contact should be brought to your doctor's attention immediately. Sign 9. What science is seeing: brain signatures and AI. Our final sign isn't something you can see, but it's the science that helps explain everything we've discussed. Neuroscientists are identifying objective biological evidence. For example, studies using EEG scans have found that autistic children often exhibit a higher aperiodic offset, which can be thought of as the level of background electrical noise in the brain. This may reflect differences in how the brain matures. Furthermore, autistic children with language impairment often show lower alpha peak amplitude, indicating a disruption in the rhythmic coordination across brain regions. Excitingly, new technology is providing scalable tools that go beyond subjective reports. Voice acoustic classifiers can identify vocal patterns to detect autism with high accuracy. And apps like Sense2Know can analyze digital phenotypes, like gaze patterns, head movements, and blink rate, to help differentiate autism from other developmental delays with up to 88% accuracy in recent studies. You can't see these signatures, but you can see the behaviors they produce. This is why the big picture, the quality of interaction, not just the quantity of words, is so important. If you found this helpful, please subscribe and click the bell. Please, share your experience in the comments. Reading each other's stories reminds all of us that we are not alone on this journey.